Imagine cleaning an old storage room, and a few days later you develop fever, body pain, and difficulty breathing. Within hours, your lungs begin to fail. This is not fiction. It's caused by a dangerous infection known as Hantavirus, a rare but potentially fatal disease spread mainly through rodents. Although uncommon, Hantavirus outbreaks have caused serious illness and death around the world, including North and South America, Asia, and Europe. Today, we'll uncover what Hantavirus really is, how it spreads, early warning signs, why it becomes deadly, and most importantly, how to protect yourself and your family. Hantavirus is a group of viruses carried primarily by rodents, such as mice and rats. Humans usually become infected after breathing in tiny virus particles from rodent urine, droppings, saliva. The virus can become airborne when contaminated dust is disturbed during sweeping, vacuuming, cleaning closed spaces. There are two major forms of hantavirus disease. 1. Hantavirus pulmonary syndrome, HPS, mostly found in North and South America. This severe form attacks the lungs and can quickly become life-threatening. 2. Hemorrhagic fever with renal syndrome, HFRS, more common in Asia and Europe. This type mainly affects the kidneys and blood vessels. You do not need to be bitten by a rodent to become infected. Most people catch hantavirus by inhaling contaminated particles in the air. High-risk situations include cleaning unused cabins or sheds, entering dusty storage rooms, farming activities, camping in rodent-infested areas, handling firewood, working in grain warehouses. In rare cases, infection may occur through rodent bites, touching contaminated surfaces and then touching the face, eating contaminated food. Some hantavirus strains in South America may even spread between humans, although this is uncommon. Early hantavirus symptoms often look like the flu, making diagnosis difficult. Symptoms usually appear 1 to 8 weeks after exposure. Early signs include fever, severe muscle aches, fatigue, headache, chills, dizziness, nausea and vomiting, abdominal pain. Many patients think they simply have a viral infection, but then comes the dangerous phase. After several days, the virus can suddenly attack the lungs. Patients may develop cough, chest tightness, severe shortness of breath. Fluid begins leaking into the lungs, making breathing extremely difficult. Doctors describe it as feeling like a tight band wrapped around the chest. This stage can progress rapidly and may require intensive care, oxygen support, mechanical ventilation. The mortality rate of hantavirus pulmonary syndrome can reach around 35% to 40%, even with medical treatment. Diagnosing hantavirus early is challenging because symptoms mimic influenza, COVID-19, pneumonia, dengue, other viral illnesses. Doctors usually rely on exposure history, blood tests for hantavirus antibodies, chest imaging, oxygen level monitoring. Early recognition can save lives. Currently, there is no specific antiviral cure approved for most hantavirus infections. Treatment mainly focuses on supportive care, oxygen therapy, careful fluid management, blood pressure support, mechanical ventilation if necessary. The earlier treatment begins, the better the survival chances. Some antiviral drugs like ribavirin may help certain kidney-related hantavirus infections, but effectiveness varies. Because there is no guaranteed cure, prevention is extremely important. Here's how to reduce your risk. 1. Control rodents. Seal holes in homes and cabins. Store food properly. Remove garbage regularly. Keep areas clean. 2. Avoid sweeping dry droppings. Never sweep or vacuum rodent droppings directly. This can release virus particles into the air. 3. Use safe cleaning methods. Instead, wear gloves and a mask. Spray disinfectant or bleach solution first. Let it soak for at least 5 minutes. Wipe using paper towels. 4. Ventilate closed spaces. Open doors and windows for at least 30 minutes before cleaning old rooms or sheds. 5. Be careful while camping. Avoid sleeping near rodent nests. Store food securely. Keep campsites clean. One of the most famous hantavirus outbreaks occurred in the United States in 1993 in the Four Corners region. Doctors were shocked by healthy young adults suddenly developing severe respiratory failure. Researchers later linked the outbreak to deer mice carrying the sin nombre virus strain. Since then, sporadic outbreaks have continued worldwide. Climate changes, rainfall patterns, and rodent population growth can all influence outbreaks. Hantavirus may be rare, but it can become deadly within days. Understanding the risks can help prevent tragedy. Remember, rodent exposure matters. Early flu-like symptoms should not be ignored after exposure. Safe cleaning practices can save lives. If someone develops fever and breathing difficulty after contact with rodent-infested areas, seek medical attention immediately. Awareness is one of the strongest weapons.